Good morning, everyone. Happy Wednesday. Thank everyone for being here today. Today we are here to launch our strategic plan for the Office of Violence Prevention and Trauma Recovery. The office was started ultimately in 2020, and in the wake of COVID, we had to come up with a plan to be able to launch this in the wake of George Floyd, right? When we had all of the national headlines around defunding of the police. Mayor Raj J. Baraka signed an executive order for us to create an Office of Violence Prevention and Trauma Recovery where we're not defunding the police, but we're reallocating funds for violence prevention, for trauma recovery, for healing in our cities, and to be able to highlight trauma that has happened as a result of not having enough investment in our communities. And so we are here today to talk about this plan that included so many people in trying to help us move this mission forward. And so we ultimately spoke to hundreds of people in the community. We did community listening sessions, and we asked the community, what is it that you want? And what is it that you need to see? We went in each ward and got feedback from the community. Ultimately, we had these conversations, and we included the conversations in the plan that we are releasing today. We had our community partners that are here today. That includes the Brick City Peace Collective, Equal Justice USA, our Hospital Violence Intervention Program, The Hub, My Brother's Keeper, Newark Anti-Violence Coalition, Newark Community Solutions, Newark Community Street Team, Opportunity Youth Network, Newark Public Safety Collaborative, Newark Street Academy, West Ward Victims Outreach, Shani Baraka Center, and our partners and consultants that helped us put this plan together was Bloomberg, Results-Driven Consulting, and we had an advisory team that included Equal Justice USA, Achilles Sherrills, Katine, Will Simpson. And this plan, Shoshana Page was our policy advisor that also helped, and Kalisha Wingfield Hill. And without Andrea Mason in our People's Assembly, we would not have been able to get the message out enough. And so this plan today that we're going to release has 4 pillars. We're talking about 4 things that we want to do initially. While we know that we need to do so much more work, we know that we have to start with having common and clear roles and demands around what we're trying to do. So number 1, and we have them here on our boards, supporting communities to have an active role in creating public safety. And so we know that we cannot have public safety without the public, and community has to be at the center of everything that we do. They have to have input. They have to be involved in the conversations. They have to be at the table in the beginning and not at the end. We want to mobilize community and law enforcement to focus on the hot spots. So we know that a small amount of the people are committing the most amount of violence. How do we focus that? And so we ultimately have teams and our partners who go into those communities and they put the resources there. And we get information and we use data from law enforcement to know where things are happening. And so we are mobilizing community and law enforcement to focus on those areas. We don't want to be all over the city where there's not a lot of crime and violence taking place. And so we're shifting the culture to think about trust, healing, and resilience. That's the ultimate goal, right? Because we know that there hasn't been a lot of trust in our law enforcement, in our systems, and so we have to rebuild trust in the community. And we have to build the community to know that they are resilient and they can bounce back from whatever the harms are that have happened. And so we are building and we're doing healing work, right? Because healing is the ultimate goal. Yes, we're reducing crime and violence, but healing is the true goal of what we're doing collectively. And we're investing in the capacity of people and resources working to prevent violence. Again, there's been a lack of investment in community-based organizations, in our schools, in our institutions, and so we're putting the money back into the community, and not just funding, but real estate. So we are at the first precinct, the former first precinct on 1017th Avenue, which is one of the precincts that the '67 rebellion sparked out of. So a place that was a place of harm and police brutality is now a place of hope and healing. So we're transforming the way that we do this work, and not just in this city, but ultimately giving us a place to do that. So investing in real estate, but also investing back into the community-based organizations. We put out an RFP last year for $1 million, and we just finished another RFP for $16 million. So $17 million, and we have another $2 million that we are investing to refund the people. Not incarcerate, not punitive ways, but to be able to help community partners to be able to fund their work in a way that shows that we truly support them. And so the way that we're doing that, we're adopting a public health approach to violence. It has to be in public health. It can't be all public safety. And public safety can't do this work by themselves. Law enforcement can't do this work by themselves. So we are partnering, and we're working shoulder to shoulder in this work. We're treating the whole person and their environment. We're coordinating efforts from public safety, public health, and community-based organizations. We're investing in successful community-based programs, the people you see here today. We're monitoring and evaluating practices. We're creating new initiatives where gaps were found. So we're looking at the data and we're saying, where are the gaps? And we're filling those gaps in the best ways that we can with the people that we know can do the work. We're building staff and collaborators capacity, so we know that a lot of the people have been doing this work in silos and by themselves for so many years. So we're helping them to build capacity. We're helping them to be able to be funded so that they can have staff to help them do this work. And we're caring for the mental and physical health of social workers on the ground. So we have social workers that are embedded in all of the police precincts, our 5th precinct where people are in custody, and we also have juvenile services. So we are putting social workers in places where there still may not be people who want to talk to law enforcement, but there are posters in every police precinct that says social workers are available upon request. And so the social workers are doing the work. Our outreach workers are doing the work. That's the A-team, on the grounds, shoulder to shoulder, doing the work. First responders, they are there as first responders, and there have to be equity in this work. And so the people that you see here are the people that we value, the people that we work with, the people that we meet with, the people that we are investing in to help us to be able to create healing in our community, to invest back into the people who've never been invested in. And so that's what this plan is about. And as we continue to build this plan, because it took us so long to finish it, we are certainly going to continue to build upon it. So at this time, I would like to invite our mayor, Mayor Raj J. Baraka, to come forward and to be able to talk to us about this plan and about his vision for the Office of Violence Prevention and Trauma Recovery.
Thank you. Good afternoon. Was it morning? Good morning. Obviously, I want to thank Bloomberg, because I'll never get a chance to thank them for their partnership here with us in the city of Newark in various capacities and ways, but specifically today around helping the Office of Violence Prevention and Trauma Recovery put out this strategic plan, which is well organized, well thought out. I want to thank Director Yuri and the work that she's been doing tirelessly and oftentimes thanklessly over the years, not just as the director of OVP and trauma recovery, but as, before that, a community activist and a social worker of her own kind, and doing the work that she does ultimately to try to resolve issues that take place in our city. Obviously, Kalisha Wingfield Hill and Brick City Peace Collective, who stepped up to the plate when I created this organization. She stepped up to the plate and began running immediately to get this thing moving forward. And all of our partners that are here that do the work every day, not just the people who work directly for OVP, and all of the organizations that are part of BCPC, and I think Keisha outlined all the organizations, so I don't want to go through all of that because I know I may forget somebody and you'll be outside upset that I didn't say your name. So I think she said everybody. And I just want to thank everybody for participating in what we think is a real plan, an ecosystem that we created here in the city of Newark from scratch. And that's very, very important that we created it from scratch. And now that it's getting the kind of support and accolades from around the country, people are coming here. We were able to host mayors from the National League of Cities. We are about to host the African American Mayors Association here in the city of Newark, for mayors all over the country who are dealing with a double kind of problem. They're dealing with the rise in violence and crime, but also the rise in unconstitutional policing simultaneously, and having to figure out how to reduce both of those things. And especially in places where the context has been, you can't reduce crime without unconstitutional policing, and that's just not true. That you can uphold people's rights, tell them, that's right. You can uphold people's rights and and follow the Constitution of the United States, and at the same time reduce violence and crime. In fact, in Newark, we are arresting less people than we were 5-10 years ago. So we're making less arrests, but we also seeing a constant reduction. And what does that mean? That means that there is no causal relationship between arresting people and a reduction of violence and crime. That's what the data shows. I'm not making that up. The data tells us that. It tells us that nationally. It's telling us that here in the city of Newark. It means that there are a lot of other factors that are involved. And it also means that the broken windows model didn't work, and it never worked. And in fact, it just caused broken practices and created in Newark what we're under, which is a consent decree. So as a result of that, well, not even as a result of that, we began to talk about, years even before I was able to get into this position, as violence as a public health issue. We were out in the streets saying violence is a public health issue. And it is a public health issue. It is an issue of public health. And the one thing we do well in this country is public health. When we respond to public health crises, whether it's the measles or mumps or COVID or polio, we use the public health strategy, its ecosystem, its resources to reduce those diseases. And if we treated violence that way, and we used to say, I used to say when we were in the street, if there was a mosquito that came in this place and bit one of us right now, and we died from that mosquito bite, right? There would be all kinds of protocols that were set in place to find out where this mosquito came from. How did it get here? What was the makeup of the person it bit? What household did they live in? What was the mother? What did they have for dinner that night? What school they went to? All these things would go into finding out why this mosquito bite killed this person, one person. And I would say if there was an infection in the school, whether it's a staff infection or anything like that, there's all kind of protocols, state protocols, municipal protocols that set in place. We have to clean the school. We have to clean the classroom. We have to go to people's houses and make home visits to make sure that this thing doesn't spread. But when people die in our community, everybody goes about their business, especially when black and brown people die. Everybody go about their business. In fact, when there's record epidemic numbers of violence, people still go about their business. In fact, there more violence is happening in these cities across America than when they first started recording violence happening at that record level, and people are still going about their business. And so we created an ecosystem here, and there's three pieces I think that's important that Keisha laid out. One is data. We're doing our best to gather all of the data that we can around our interactions with people, and all of the police data that they're giving us. And thank God the police are giving us the data, and working with Rutgers University, who's been an awesome partner in helping us use data to respond to violence and crime in our city. The other piece of it is our ability to focus on hotspots. And that is a public health approach, period. When we looked at COVID, we would always use these maps. We got these COVID maps, and there's red parts of it, yellow parts of it. These are the areas of the city where COVID is the most rampant, right? And they'd use that in the national government. They use that in state government. Here locally, our health department put up maps for us. We call those hotspot maps. We sent workers out to those areas to tell people how they should behave. COVID is rampant in this area. This is what you should be doing. We used to pass out stuff to them, give out masks to help prevent people in that area, set up vaccine and all kinds of testing sites in that area because those are hot spots. We want to do the same thing with violence and crime. We say these are hot spots. So we just don't want to send police to those hot spots, and we do. We want to send social workers to those hot spots, outreach workers to those hot spots, job trainers to those hot spots, street pavers to the hot spots, all of those folks to the hot spots to begin to reduce what's happening in there. And the last part of it, which I think is most important, is collaboration between public safety, public health, and the community. That's to me is incredibly important. You can't have one without the other. In some cities, they have street teams, but there's no collaboration with the police department. They might have a street team that collaborates with the police department, but there's no collaboration with the health department. You need a collaboration with all three. All three agencies have to work in tandem together, marching to the same beat to get to the outcome that we want to see. The best example of the relationship between public health and public safety is the seatbelt law. The culture of seatbelts in this country has changed tremendously. All of the deaths that we've got from accidents prior to the relationship between public health and public safety. Now you can't even take your child out of the hospital without a seatbelt and a car seat, right? You cannot even come out of the hospital unless you have a car seat because of the culture change. Kids will even tell you now, put your seatbelt on because of the culture change that has happened around seatbelts and the police department or public safety. That's the relationship that we need. We need a culture shift, a culture change, where we reduce violence and crime, we reduce arrests, we reduce the need for over-policing in our communities, and we provide resources to the folks to be able to pull themselves out of situations that they haven't even created for themselves, by the way. So it's important that we do this work. I'm proud of the work that's going on. It's hard work. Let me just say that. It's hard work. It's not work where you see results overnight all of the time. But if you're working out here, you see results immediately because you see people's faces when you come and give them the assistance that they're looking for. You see hope that people have when you're working with their families, when kids get opportunities that they never had before because you showed up. You get an opportunity to see that immediate gratification because of the work that we're doing. So we're funding this work because we have to. Right? And I'm glad that the White House is beginning to do the same thing, that they're funding this work nationally. We want them to fund it at greater levels. I want to thank the state government for beginning to fund this work, and they need to fund it larger. In fact, the state government has now created its own Office of Violence Prevention and Trauma Recovery. I'm trying to figure out where they got that idea from, but we want to thank them for also creating the Office of Violence Prevention on the state level as well, really saying that what we're doing is not just right, but it's working. So thank all of our partners here. Thank our council people that are here. Assemblywoman Shanique Spade is here with us today. Thank her for her support down in the legislature as well, and all our state delegation who helps us make this stuff a reality. So thank you.
Thank you, Mayor Baraka, for those words. We are doing this launch this week as a remembrance and as a acknowledgement for National Crime Victims' Rights Week. And so we know that people are victimized all the time, and a lot of times they don't know their rights. And so there's a whole week dedicated to different programs statewide and nationally to be able to acknowledge crime victims and for them to understand that they have rights and there's resources out there for them. So this is a kickoff for National Crime Victims' Rights Week for us. We would like to acknowledge other partners that are in the room as well. We acknowledge our council people, ultimately Reverend Roundtree. She is a first responder as well. Our clergy are out there partnering with us because we know we need them. We have Hope, Love, and Kindness. We have Urban Care. We have Leaders for Life. We have our partners that are here, New Direction. And so we ultimately want to acknowledge our representative who's here from the State Office of Violence Prevention. Steve Campos is here with us as well. Steve has been a part of the work shouldering with in Jersey City, with Jersey City Anti-Violence Coalition movement, and been doing this work for some time. And as the mayor stated, this work has been groundbreaking for years. It's not overnight, right? We've been doing, mobilizing and organizing for the last 15 years or so around violence prevention work. And so at this time, I would like to invite our Assemblywoman, Shanique Spate, to come forward and to bring us some words. Thank you for being here today.
Thank you so much for having me. Mayor, it wasn't my idea. I did not give the state, permission, so that wasn't on me. Good morning, Mayor Baraka, Director Yuri for doing such a great job, City Council, and so many special guests that's in the room on today. I am extremely honored to be a part of what is taking place on today. As a lifelong Newarker, a mother who raised my family in the city of Newark, a law enforcement officer, and a state legislator who seeks every opportunity to elevate the needs and experiences of Newark residents and people from underserved communities down in Trenton. I am proud to witness the progress that is taking place throughout our city because of great leadership and initiatives like what is being launched by the Office of Violence and Prevention today. We know that violence is truly a public health issue, just like our mayor said on today. Unfortunately, the crisis primarily impacts communities like ours, like Newark, that are heavily populated, under-resourced, and overstimulated because of trauma. These types of issues calls for our attention and action. I am proud to say that the city of Newark answered that call. The Office of Violence Prevention has established an innovative approach to combating violence in ways that not only address the issue through a public safety perspective, but also supports the well-being of those who are impacted. For years, I have been a huge advocate for the provision of access and supports to services of victims of crime. I have created and pushed several pieces of legislation that will require the state to create a solid, systematic approach to making sure victims and their families are taken care of. This work was motivated by what I know and see throughout our city in terms of cycles of violence that not only impact violent actors and victims, but also their entire community and their families. I am proud to say that a lot of what I envision for what a cohesive system should look like at the state level is happening right here in our very own city of Newark. I want to commend our mayor for his leadership. He is always leading the way, always leading the charge, and when I think of our mayor, I always think of him as Noah's Ark. The work that is being done in Newark is a national model of excellence that sets the standard for what violence intervention and prevention measures should look like as cities across the country are experiencing increased crimes. I commend the Office of Violence and Prevention and everyone who was involved in this great work. May God continue to bless our city and all the people that's putting their hands on this process and this great work. Thank you so much.
Thank you, Assemblywoman. At this time, I would like to call up our Executive Director for the Brick City Peace Collective, Director Kalisha Wingfield-Hill.
Good morning. It is my honor and privilege to serve the residents of the great city of Newark in my role as the Executive Director of the Brick City Peace Collective. Brick City Peace Collective works to reduce violence by bringing together members of Newark's public safety ecosystem to promote effective collaboration, informed strategy, development, and implementation. Through leveraging the city's collective power, Brick City Peace Collective is able to drive systems change strategies which center those most impacted by violence while creating a sustainable pathway toward peace. My grandmother would often ask us as children, what do you value? Here we value compassion, understanding the importance of being caring, loving your community, and collaborating. Our dedication to improving the quality of life for Newark residents is unwavering. Together, we can decrease violence, change lives, and create a safer and stronger future for all. I am truly excited about the work that we have done and the work we continue to do. We need high-risk interventionists, social workers, and opioid response teams. We need Trauma to Trust, My Brother's Keeper. We need Opportunity Youth Network, Leaders for Life, and Newark Street Academy. We need Newark Community Street Teams, safe spaces like The Hub, Hear My Cries, and the Shani Baraka Center. We need ReFAL, Urban Care, and Newark Anti-Violence Coalition. We need safe passage to schools, and we need our young people to know that despite the poor decisions they may have made in the past, it is okay to go in a new direction. We're fighting for what we believe in together. Everyone is worthy, and more importantly, everyone is needed to win. Thank you.
We want to thank Director Kalisha Wingfield Hill and the Brick City Peace Collective. The Brick City Peace Collective existed before the Office of Violence Prevention, and we ultimately had Dawn Haynes, and we had that strategy of the Board of Education being a part of this system, right? We had Sharifa Minhotep, we have Ms. V and Ashia, so we knew this partnership with the Brick City Peace Collective is strategic because we need an accountability arm, right? We need a collaboration and a partnership arm, and that's what the Brick City Peace Collective is to the Office of Violence Prevention. We would like to acknowledge Pat Council, who is here with us as well. Again, our council people, we can't do this without. And so I want to keep acknowledging them because when we come before them to get things passed, we need to be able to have their support and for them to understand what the mission and vision is so that they can pass our things or get the information out to constituents in their respective wards and citywide. At this time, we're going to bring forward Sonia Rogers. Sonia is a person in our community that we've been working with for so many years, but ultimately she's a part of our family. And when you're in the streets and you're doing this work, and when you have a person who this has landed on their doorstep and they continue to show up, then you have to bring them and you have to support them and you have to wrap your arms around them. And so Sonia Rogers is going to come forward at this time, and we're going to give her some love as she comes forward.
Hello, good morning. Good morning. My name is Sonia Rogers. I'm a resident of the city of Newark. Today comes as a day as I'm a walking calendar. I'm also a mother that buried 3 children in this city. My children were shot and killed 6 months apiece and 2 days after Christmas in 2015. May the 31st, 2011, my son was shot. On June the 21st, I had to make a decision along with a friend that wasn't a mayor, that wasn't a councilman. He was my friend at the time, to take my son off of a respirator that I have to live with every day of my life, because the same wounds that my son sustained, people are living from those wounds now. So I have to live with the fact that I killed my son. The second part is I have to live with the fact that my second son passed away 6 months apiece that didn't give me a time to grieve for the first one. My third son passed away 20 minutes after he left out of my house and told me that he was going to return, but he never returned. I seen the video of my third son being slain with the back of his head being blown away. I stand here today with a heavy heart but I'm going to stand here and tell my story, and I won't fall. My name is Sonia Rogers, and I'm a resident of this city for 49 years. The Office of Violence Prevention wasn't here when I was going through what I was going through. Keisha Yuri was here. Keisha Yuri walked the beat and talked in my ear and let me cry on her shoulder. I didn't know the Office of Violence Prevention. I wish, like heck, they were here for mine. I wish they could have saved mine or helped save mine. I wish I could have helped save mine. I have to speak on mothers of this city because we get ridiculed when our kids pass away. It's not our fault. We raise our children. The mothers from this city, we love our children, and we raise our children every day. We cannot help the fact that someone comes here that lives here from our city or comes from somewhere else and kill our children. We can't help that. The mothers here love their children. It takes a village to help raise these children. I am blessed that the village I had was now the mayor. I'm blessed that the village I had was Keisha Yuri. I'm blessed that now I have a person that I can call a mother because I didn't have that, Ms. Roundtree. These people I don't look at as city officials. These are my family members. Keisha, thank you for everything. I so appreciate you. Because without you, I don't think I would stand here. As long as some other familiar faces sitting in this room, I appreciate you, and I appreciate every last one of y'all. Mr. Baraka, thank you. Thank you so much. It's not easy carrying a whole city on your shoulder when you have people in this city that are going through. For a black person, going through something means you're enduring a lot. This young man endures a lot. He carries this whole city on his shoulder. It's not fair for us in this city to blame him when something happens. He didn't pull a trigger. He didn't do anything but try to help. As I stand here today, I said I am a calendar because I'm a walking emotional calendar because this month was my baby's birthday. My baby turned 27 years old. My sons passed away at 21, 21, and 20 years old. For me to still be able to try, to walk, to talk, to get up every day is a struggle of my life. I have a granddaughter that has never seen her father before. I have a granddaughter that I can't even be around to see her because my son took his face and sat it directly on his daughter. I can never, ever see my children again. The hardest thing that a woman ever has to bear. This walk that we're trying to walk, I will walk with you. I will help you. I'm not standing here for sympathy. I'm not standing here for your empathy. I'm standing here for every black mother in this city that buried their children. I'm standing here today. I'm not standing here just for myself because I have sisters that don't even know they my sisters that's in this struggle that lost their children. Some of them didn't lose their children from gun violence, but they're needed and they're wanted and their voices are heard. I also have a nonprofit organization called Through Our Voices. My struggle didn't start with my own children. My struggle started with myself because I also lost a mother in the city of Newark. So with that being said, I appreciate you all. This definitely was not easy for me today. It's hard being a parent in the city of Newark. It's very hard, but we do it every single day. I commend every black woman that gets up in this city that's walking on a broken heart. I commend you all because it's not easy. I came here today with the strength that I had to pull up. Nobody will ever understand that strength. So as I once said, it's not sympathy, it's not empathy, it's help. I'm mentally destroyed, and I'm not scared to admit it anymore. I'm mentally destroyed. I'm mentally depressed. I can't function on a daily basis. The way I function on a daily basis is I have to affirmate to myself. Mr. Baraka said you try something for 21 days, it becomes a habit. So for 21 days, I try to get up and go to work because I have to. Because I can't come and knock on their doors because I need food, which I can, but you have to work. So you have to stand for something and fall for nothing. So, thank you.
This Office of Violence Prevention and Trauma Recovery is a personal work, right? It's not just a job. You cannot do this work if it's just a job, because you cannot get up every day and have to hear the cries and have to hear the shrieks and have to see the tears and have to still help and show up for people when you can't show up for yourself. And so that's what you witness here. Sonia represents the thousands of families in this city that we show up for. The people who call us, we out 2, 3 o'clock in the morning, phones ringing, don't stop. And so the tears and having to hold them back, the anniversary dates don't stop, the birthdays don't stop, the burial dates don't stop, the smell don't stop, right? And so this work is a personal work, and for anyone across this country that's trying to stand up an Office of Violence Prevention, you have to know that it just can't be a job, because you have to be able to shoulder and stand up and stand in the gaps for folks. You have to be able to be on their doorstep. You have to go to the funerals. You have to go to the hospital, and you have to stand up. You got to fight for them when they can't fight for themselves. And we get up every day and we do this. And Mayor Baraka knows, because he's responsible for a whole city, but he has his own stories, right, of folks that he got to show up for. When we borderline hurting ethics and laws and rules just to be able to help people, because the rules are not written for us, right? The laws are not written for us. They don't understand that we lose people at a rate that nobody else does. So we got to do things different. And so at this time, we're going to close our press conference. We're going to hold space for those folks who couldn't be here today, and for those lives that we've lost, and for the victims and survivors that sit here because we are the work. Most of us in this room are the work. We come to this work by way of being the work. And so we close out at this moment. We're going to ask for the press to have questions. Mayor Baraka, come forward for us to answer questions, press only. Thank you.
About this topic only.
About this topic only.
Mayor, Mike Emmer just got here. Could you share a little thought about how Newark's become a model for the rest of the nation? Share some thoughts like that.
Well, I would say that wasn't our intention. So I think it just happened because we took risk that other people either didn't want to take or couldn't take, because I have to admit that we have a space in New Jersey that allows us to do things that other people may not have the opportunity to do. Despite the struggles we have around some of the confines, we are freer to do things here than they are in Mississippi, for example, or in Georgia. So I'm thankful for that. We created an ecosystem of first, Newark Anti-Violence Coalition, Newark Community Street Team, Brick City Peace Collective, and the Office of Violence Prevention, and all these things happen because necessity is the mother of invention. We created the Brick City Peace Collective because there's a whole lot of organizations in the city who've been doing this work before people even called it the work. And they needed funding to be able to continue to work and grow their work across the city, and not just in small places, and be directed and be given data and say, this is good, so we need you to repeat it in this area. This is not good, so don't do that anymore, let's just do this. So Brick City Peace Collective is designed to bring all organizations together so people know it ain't just your one organization that's the answer, it's all of us collectively. The Office of Violence Prevention became necessary because the city needed a direct arm in making sure we kind of directed what was happening in terms of the organizations that are out here in the community. And then there needed to be a direct connection between City Hall and community-based organizations that are doing this work. Because the police aren't just going to go hang out with the Newark Anti-Violence Coalition. The police are just not going to go run over to the Newark Street Academy or Newark Community Street Team and say, oh, we work together. The city government has to direct the police to do that. And through the Office of Violence Prevention, that's why that is possible for us, to be able to have that relationship that nobody else has. And we thought that we needed to seed it in the health department because this is a health issue, a health crisis. It is not, and that's important to us because before that, people were saying that we had some kind of proclivity to violence, which is racist, by the way. And so violence will continue forever. You can't stop violence because we were born violent. Right, and so we wanted to dispel that and let people understand that that was mythology in real life, that there are systems and things that are taking place in our community that create violence and create opportunities for more violence. So it has to be in the health department. And so while we did this work, more mayors are now across the country and the state are coming to Newark, in the state, whether we work with Patterson, we work with Camden, we work with Trenton, we work with Jersey City. All these organizations that have been coming here. Baton Rouge, Louisiana, have been coming back and forth, working with Office of Violence Prevention and Newark Community Street Team. Mayor Wooten there just announced almost 30% reduction in violence and homicides in her city because of the relationship that she's had with us here in the city of Newark. The National League of Cities came here. Now the African American Mayors Association is going to show up here in a couple of weeks. So that's important. Because it means that we're helping other people. And as we help them, we help ourselves. Because it makes us look further at what we're doing so we can sharpen what we're doing and make it better. Because when people are looking at you, you got to make sure they see what what they want to see, right? So we're working on ourselves at the same time. So, yep, thank you for that question.
Mayor, you noted that the administration has to direct the police department to do these things. What kind of relationship, what kind of buy-in have you gotten from the police department in this, which essentially takes money from what would be directly from the police department to another perspective? What has their buy-in been?
Yeah, I think it's been incredibly positive. Actually, we have seats at CompStat. So they sit directly at CompStat when the police brass are going over crime and violence. They sit there and get information. And one way I know that it's been effective and working is because when I'm in CompStat, I hear police officers saying that we're going to make a soft handoff to OVP. And they don't even know that lingo. That lingo is lingo that these practitioners use, soft handoffs and all that. That stuff, police don't talk that way. And when they start talking that way, it means that there's a culture that's beginning to impose itself on them, right? And the fact that they realize that, look, I've been arresting this kid for this is the sixth time this kid's got arrested. Maybe we ought to give him the OVP this time, you know? And that in and of itself is proof that we're beginning to get the buy-in. Are we all the way where we need to be? Absolutely not. But we are miles and miles away from where we started off. You know, that's why at the State of the City, I showed the image of the article in the paper that says mayoral hopeful writes letter for gang member, because at that time the sentiment for this work was very negative, right? It was very, very combative, the sentiment for doing this work. But also at that time, crime in Newark had risen every year for 4 years straight in a row to a point where homicides grew over 100 homicides that year before. You had your hand up, Steve? Oh, no.
Mayor, I wonder if there's any other way that you envision for yourself to spread what you're doing in the city.
That was slick there, Steve. That was good.
Reminded what a leader Newark has been and how it's been handled, not only across the state, but the nation and so forth. And we don't know what to call.
Yeah, you're not going to flatter me into that answer. No, but I get it. I think we're doing that now, though, honestly, as, you know, Keisha, Yuri, Kalisha, Wingfield, all the other organizations, they talk to the other organizations more than I talk to even the mayors, right? Because the folks there want real people to talk to. And they talk to these folks and figure out how to get these things done. When the National League of Cities came, they went and visited all of these people. I had a private conversation with mayors, you know, why that was going on, but they visited all of the organizations, all of the things that were going on to spread this work, because the work is more important than me, right? So, you know, that's important. And we wanted to outlive individuals. We want to create systems to outlive individuals, and it shouldn't be about me. It should be about the work that's happening. And if I do anything right, it would be able to leave this kind of legacy behind where this work takes place, even if I'm gone, that this happens. Now, you want to say, would I be willing to express this across the state of New Jersey? Absolutely. Absolutely. Well, thank everybody for coming out. Appreciate you.